Hey guys, come on in. Tonight we are going to talk about how to start a home care business in Maryland. And it is absolute my favorite state. Why? Because it is the first state that I got licensed in back in 2006. Thanks so much for joining. If it's your first time watching me, please let me know. Where are you watching me from? Where are you watching me from? Thanks so much for joining. And we're going to get started. Where are you watching me from? Your first time. Thank you. Where are you watching me from? Tonight. Okay. Hey, Detroit. Yes, I was talking to you in the DM. Let me know where you're watching me from. Virginia Beach. Okay, great. Okay, so for those of you who are just starting to follow me or have never seen me online, I do go live pretty often. Hey, ATL. Yeah, I'm looking forward to our conversation. Indiana, thanks so much. I am looking forward to our conversation. Normally on Thursdays, I do a group training for my home care CEO mentorship program. But tonight, my kids had, hey, Nashville, they had soccer practice for their big game coming up this weekend, and it just totally threw my schedule off. So I wanted to go over, hey, PA, I wanted to go over how to start a home care agency in the state of Maryland. Now, for those of you who are just joining, like I said, Maryland is my absolute favorite state because Maryland will be considered my firstborn. It's the first state that I started my home care business in and a skilled home care agency. So what I'm going to do tonight is go through some things. No, but my business bestie, she's actually called the assisted living coach. She can help you out with that. Tonight we're going to talk about Maryland. If you want to know about your state, please make sure you drop the name of that state in the comments. Maybe I've already covered it and you missed that, and you can get that free training, or maybe we'll be covering it soon. But we're kind of like out of order. So please bear with us. So tonight we're going to go over the application process, and we're going to go over some of the requirements and give you something that is one of my favorites, and that's some of the statistics. And I was talking to one of my mentees who has a home care business in Ohio, and she said she wants to start another one in Pennsylvania, and she was like, I hated statistics in school. And Sean, you're always, hey, South Carolina. She said, Sean, you're always going over the statistics. And I said, yep. I said, believe me, I hated them in school too, but this is something I've grown to love, and it will definitely help you with making a decision to get started, because once you see the numbers, it can either encourage you or discourage you. And then B, it's going to really help you when it comes time to our marketing strategy. And for those of you who do not know, you can go on LinkedIn. You can check my educational background. I have a background in international business. I started my home care home care agency with a pediatric focus back in 2006 because I had a business mentor who was a registered nurse. I'm not a nurse, never been a nurse. My business mentor tried to encourage me to go to nursing school, but I didn't. I went on with her help and with the help of God to go from my first year, from I'll say 0 to 2 years, I generated 3.3 million in revenue, and then I continue to grow. So everything that I share with you guys are from my victories and some of my mistakes, because I want you to avoid them. So but tonight we're going to really get into, make sure I pull up the application. Now first, one thing I need to set the record straight per se, is that in the state of Maryland, they call their home care agencies RSA. That stands for Residential Service Agency. RSA, right? Now there's a RSA1, and the RSA1, I'm reading this part so I don't forget, is basically at the level of a homemaker and companion. You will need an RN on your application. I know you're like, dang it. Yeah, because some states, like Connecticut and Pennsylvania, even Texas, like you don't need an RN on your application. But for Maryland, you do. Maryland can be a little strict. So it specifically is the level 1 is your homemaker companionship license with the RN supervising the home health aides, and they want to emphasize that you're not giving out any medications. You're not giving out any medications, and you're not doing any medication management, which means if you had a level 1 and you were caught advertising that, yeah, we'll do medication reminders, that would be considered medication management, and you can get dinged for that. Now, RSA level 2 is basically your traditional non-medical or personal care services, and that does include medication management. Why? Because at that level, they're expecting you to have home health aides and CNAs, certified nursing assistants. Now, one thing that I thought was obvious, but I like to make sure I clarify, if you have a level 2, you can automatically do 1 and 2, means you can have personal care with homemaker, with companion services. So it's kind of like as you keep moving up the scale, you will be able to do the services that fall underneath that level. Now the top tier level is level 3. It's considered complex care. This will be your skilled care. This is the level that I had. That care is provided by registered nurses, licensed practical nurses, and underneath the supervision, and you can have home health aides as well, and basically everybody at that point gets supervised by the registered nurse. And there it's called complex care because if you're not, that is where you would have like your tube feedings, maybe individual with a tracheostomy. You would have an individual with wound care, could be underneath that, even though that's like a skilled visit. But anything that has to do with you providing a complex care in the home that would require doctor's orders is basically your level 3. And that is the initial description of your sorry for the brain freeze, for the home care levels. Now, when I first got started, they were just coming out with these levels. So even though I was level 3, I kind of skipped this new process, and I don't want to go too fast, but the process is that when you, and I'm going to get into some of the application requirements, when you go to apply, let's say, for example, you go to apply for a level 3 and they approve your application, they approve your policies and procedures, they're going to then give you a provisional license, and they're going to expect you to go out and get a level 3 client and maintain that client, make sure that they're active. Basically you have to contact them, let them know that you're ready for the survey. When they come out to do the survey, that client still has to be active. And if that client is still active and they approve you, meaning that you did what your policy says you're going to do and you follow things to a T, then they would validate you officially as a level 3. But most of the time, I tell people start with a level 2. Reason why is because the likelihood of you finding someone complex care it's kind of slim initially. Now, I know I say that even though my first private pay client was complex care, and thankfully they were private pay. But if you're not as blessed as me, then you would end up paying nurses, and we know nurses are, they're not cheap, to provide this complex care until the state surveys you. And Maryland can be really efficient, but then it can also be a little slow. And please forgive me if I'm all over the place. I'm just kind of going by the top of my head because I know the state so well. So let me get into the licensing process. You can submit your application. The application is about 7 pages long. It's not an overly complex application. I'm going to try to share my screen. And actually probably only 4 pages of that 7-page application are actually where you would even fill it out. And you basically have your general information. You're going to put your business hours. What kind of company are you? Are you a LLC or INC? They want you to list every owner or director or partner who has at least 2% or more ownership of the business. Why? Because Maryland, because we're talking about Maryland tonight, reserves the right to ask you if that person has a criminal background, ask you if that person has ever had an agency before, and maybe they were trying to be slick and, start another agency with just a little bit, a small percentage, and then boom, now all of a sudden, now someone that we were trying to not have an agency now has all this ownership of an official or validated agency. So that's what they're trying to avoid. So they will ask you for the owner's information, their address, and what percentage. Then here is an interesting requirement that is specific to Maryland. Now, most states will require that you have a general liability policy. Maryland wants you, as one of your requirements for your application, get workers' compensation insurance. And workers' compensation insurance can be a little pricey in Maryland, but basically you would just tell them, here's my tip for you. I don't have any employees. It's just me. Right? And so then you would have to initiate a policy before you submit your application. So I always tell people shop around, and then if you know you're going to submit your application, let's say, for example, hypothetically May 30th, then the few days before you want to initiate the policy, and then get your policy number, your binder number, make sure you have that listed. But when you're shopping around, you definitely want to tell them, hey, I'm trying to apply and I don't have any employees. So what that does is that they will follow back up with you within a year, meaning workers' comp, and they will see how many employees you do have, because at that point they can bill you for how many employees you will be covering. Next, you're going to, as a part of the application, you're going to really state what services are you applying for. Remember, I went through level 1, level 2, and level 3. And remember, level 1 is basically like a homemaker. Level 2 is like personal care. And level 3 is your complex care. Lastly, this is something that kind of doesn't pertain to you, but you're going to private home. Yep, we're not talking about private homes today. If you want to know about assisted living, then you should contact my business bestie, the assistant living coach. So basically, this is just where you would just, have the president and any other important title sign off on what's called an affidavit. Now, that is the application. The application is pretty simple. I was going to change my screen, but for some reason, it has it has something on it, so I don't want to share with you guys that information from one of my last mentees I helped in that state. All right, there. Let me go back. I was telling you guys. Okay, if you want to start a healthcare, yep, I can help you with that. When you can actually submit your application either by mail or in person. Yes, Maryland will allow you to drop it off in person, or they have an electronic version. Now, let's get into the requirements. The requirements for the Maryland home care or RSA application is that you complete the application. Boom, we just kind of did it together. Number 2 is you have an organizational chart, which is pretty easy to do. They want to see the chain of authority that, from your board of directors all the way down to board of directors, administrator, to who's in charge and what they are in charge over. They want to know who's responsible for things. That's just how Maryland is. I don't want to say it's nosy. It's just weird. They just want to know stuff like that. Then you will have your policies and procedures. I'm going to go through some of the sections of the policies and procedures because this is where Maryland likes to, they will be pretty detailed when it comes to policies and procedures. And you can have a policy procedure manual that is about 200 pages easily in Maryland. I know you're like, how can that happen? And when I go over some of these, the policy and procedure subject lines, then you'll see, it's like, it may be like 8 items underneath personnel itself. Then they want you to submit with your application a sample personnel file. That would be, if you're, let's say, for example, if you're applying for level 2, a sample CNA file. Remember, it's a sample, so some things you're not going to have there. You're going to have like, okay, I have the application that they did work background check, whatever that's included with that personnel file. Policies and procedures for non-medical home care agencies in Maryland. It's the same everywhere. Michigan is a non-regulated state, so you can use the policies and procedures for the regulated states, and you will be in a good position, believe me, because a lot of other programs, when you get credentialed, they want to see some of those policies that other states have to write. So you would do a sample personnel file. Then they want you to do a sample patient file for an adult and for a pediatric patient. And you're like, well, what if I don't want to serve children? Then you need to emphasize that this agency will only serve seniors, right? Then this is something unique for Maryland. Other states like Virginia and Florida, they do require that you have a business plan, right? So they want to see your business plan. What are they looking for in your business plan? They want to see that you actually have a plan for growing your business, recruiting your staff. They want to see some demographics. Your business plan doesn't have to be too long, but it is a requirement. And then lastly is your workers' compensation document. Those are your magnificent 7. Those are the 7 things, key essential things that you would need to submit with your application. And let me just see. Now I want to go into some of the policies. You also, when you submit your application, this is not up there as a number requirement, but it's pretty self-explanatory. You'll also have to submit a copy of your company's, business registration, like your corporate documents, and that you're in good standing with the state of Maryland. Accreditation is not required. I repeat. So if anybody tells you different, accreditation is not required in the state of Maryland, but if you do get accredited, then they want a copy of that. So remember I was telling you guys that, the requirement for the workers' comp, one of the requirements for starting a home care agency in Maryland is that you have a workers' compensation policy. Well, if your agency does not have a workers' compensation insurance and does not have employees, so that's the key, then you're going to submit a letter of exemption. You can submit it that you're a sole proprietor or partnership, or you're going to just ask the Workers' Compensation Commission for what's called a certificate of compliance. I'll have the number for that, that you can ask for that if you're in the state of Maryland. You'll just get and that will fulfill that requirement. Okay, now we're going to get to the policies and procedures. Where's my list? Okay, so you guys ready? You're going to have policies and procedures on your governing body. You got to have policies and procedures on quality assurance. What is quality assurance? Quality assurance comes up in every state I've dealt with, and I've worked in over 30 states. Quality assurance is essentially how you're going to handle, like if there's a trend of problems, like say, for example, there's a trend, that, this year so many people had falls. Then you're also supposed to do like a clinical review, supposed to do a review of your records. It could include stuff like, submitting a client satisfaction, having a client satisfaction survey. So that's just an example. Usually a strong quality assurance policy is about 6 policies altogether, because it's a whole program, meaning it's not just one thing. So I just wanted to go a little bit in depth about it, because some of you guys go on Fiverr, or you may buy policies that just would not fly in the state of Maryland, believe me. Then you will have policies on what's called scope of services. Basically, if you are level 2, I keep using as an example, a good description of your policies, of your services, who you're going to provide those services to, and your geographic area. Then they want you to have policies on how you're going to do your billing, how you're going to do reimbursement, if you're going to have a contract, what's going to happen if somebody doesn't pay you. So this is why I say easily in Maryland, you can have about 200 policies. Then you're going to have personnel policies. In your personnel policies, they want you to cover, and this is all in the rig, so this is not suggested, this is actually a requirement. So these sections are in the rigs that they want underneath your personnel policies. They want you to have like a policy on screening, a policy on criminal background checks, a policy on verifying work history, a policy on tuberculosis or TB screening, a policy on evaluating and demonstrating of skills. And that goes for the CNA and for the LPN or RN. They want to know that you can, if you're a CNA, they want to know that you verified that they could use a Hoyer lift before you sent them with that client who has a Hoyer lift. Or on the skilled level, they want you to verify that you do know how to do a tube feeding. So they want that in a policy. Then I'm still continuing on with personnel. They want you to have a policy on staff training, requiring that certain staff have CPR, policies on infection control and ethical behavior, and policies on patient rights, policies on establishing a patient care plan, a policy on covering like adult and child, or that would be elderly and child abuse. Policies on staying in compliance with the state and the licensing board. Policies on doing a patient assessment, initial assessment, and then periodic assessments. Then patient care. If you're a skilled agency, they want you to have a policy on providing patient care that's based on obtaining physician's orders. They want you to have a policy on the supervision of your clinical staff, and then how frequent are you going to do that? Policy on your clinical records, your client records. I know you're like, really? Yep. I'm still going on with all of the policies that they want you to have. That's about it. That's about it. Thought that was more. What else should be at? That's a lot, right? Oh no, that clinical records. Oh, complaint policy. You gotta have a complaint policy. You gotta have an on-call policy. Look, their on-call policy that says in the regs is that you have to return calls after hours, on weekends, within 60 minutes or less. So, yeah, that's what I said. Maryland can be kind of strict, and but at least they're stating clearly, in a sense, what they're looking for. And basically, here I'm about to go into some of they're gonna give you. Remember, I was talking to you guys about that provisional license. They give you 90 days, 90 days to obtain 3 clients. This is what a lot of people are like, oh my gosh, how am I going to do that? Give you 90 days to obtain 3 clients. And then after you have to submit a letter of readiness, hire an RN if you don't have an RN, and basically have them conduct business according to your policies and procedures. Go do the initial assessment, have care be provided, have staff working for you, have the clinical records or the client records being completed, and to have a supervisory visit. So they want to see all of that, and they give you 90 days. So basically, you might as well say they're giving you like 45 days, because, you basically have to contact them within the 90 days to make sure that you can get your survey. Oh yeah, here it is. Okay, so actually I was right. Within 45 days, you must admit 3 patients who will receive at least 6 visits. This is on the skill side, or aid services. The surveyor will conduct a unannounced mean they're not going to tell you when they're coming, on-site visit once you have 3 patients on or after the 45th day. You must have, and then that's how you get your license. Now, here's a kicker. You cannot apply for their Medicaid program until you have an official license. So while you're with this provisional license, they are kind of holding you hostage to make sure that you're going to do what you said you're going to do. That's basically, they're trying to see if you're a man or woman of your word, and your word is based upon your policies and procedures. They're going to just check and see if you're doing all of those things. So I can go through the survey process, or I can just add it to my resource video that I will share with you guys. But let me know if you have any questions before I go to the statistical part. That's the part that tells you about the different areas. Let's see. Oh, currently there is no, and that's NO, application fee. Why? Maryland had a data breach, and So they were kind of backlogged with their applications. And so right now, if you did want to apply in Maryland to become a home care agency, it's going to take you anywhere from 9 months to 12 months. Yes, that is an extremely long time. I tend to find people who just really have Maryland set, they're just set on starting in Maryland, that they don't mind. I don't mind that. They don't mind the wait. And then I have people who are, maybe they're a nurse and they're in, or someone that's in school, and they were like, well, right around the time I finish this, I'll be licensed. So just recently we did a client analysis on market analysis, on 5 counties in Maryland. And those counties are Anne Arundel County, Howard County, Prince George's County, Montgomery County, and Baltimore County. So if you're in the state of Maryland and you're familiar with these counties, drop an emoji below. Okay, out of those counties, the largest county with the largest amount of seniors is actually Montgomery County. So according to our statistics, and I can let you guys know, see where I'm reading from, and then continue on. Is it showing you? See? Let me show you. Okay, so seniors, I'm going to start at age, because it breaks it down from 70 to 79. So I'm going to start at 70 to 79. In Montgomery County, there are about 85,437 seniors. Randomly in Prince George's County, there's 68,265 seniors. And in Baltimore County, there are 89,060 seniors. Hey, how are you? So I'm not going to go through the whole category because it's a lot. Then we looked up some data for VA, the VA population. Okay, so when it comes to the seniors, Prince George's County has the largest amount of seniors who are veterans, and that was like 11,317. Oh, actually, Baltimore County had 12,000, and that was between the ages of 65 and 74. And then Anne Arundel County had 9,514. Okay. Now, from those counties, veterans with disabilities. Let's see, veterans with disabilities. So here, that can fall. That doesn't necessarily have to be a senior. That could be an adult too, because we have veterans that are different ages that could have a disability. This would be your market of potential clients if you're looking to do the VA. That is, I'm just going to do 3 out of these counties. Anne Arundel, about 9,700 veterans with disabilities live in that county. Prince George's County, 11,547. Baltimore County, 11,032 veterans with disabilities. How about people with disabilities in general? Individual with disability, that could be a physical disability. That could be, hello, how are you? Thanks for joining. That could be a physical disability, a behavioral disability, or behavioral, developmental, physical, behavioral, developmental. We're covering how to start a home care agency in Maryland. And so if you're in Maryland, please drop an emoji. Let me know how this information is helping you. So individuals with, oh, hey, Connecticut. I did a training on Connecticut several months ago. I did individual total disabled population in Anne Arundel County is 58,838. Prince George's County, 85,973. Hey, Missouri. Baltimore, 92,959. I haven't done Missouri yet. Indiana, Indiana is a very easy state too. Connecticut and Indiana are very, really easy states. Both you can get licensed in 90 days, within 90 days. Okay. Then there's a large population in Maryland. Actually, this is something that I did with my agency. Children with special needs. This population, they did the market analysis between the ages of 3 and 21. Anne Arundel has about 11,626 individuals. Prince George's County has 18,430. Montgomery County has 22,478. A lot of children with special needs. That could be autism, Down syndrome, or something more complex, like muscular dystrophy, stuff like that. And then we listed some of the main competitors in each county. Let me see if we have any other information. Okay, computer is spooling. The last part of my statistics. So you guys may or may not know, I'm always encouraging you guys when you do your marketing that we are to look at chronic conditions, chronic diseases, and that means that person is going to need care over time, or because of this particular disease, they just need help right now in general. So again, I'm just going to do those 3 counties and tell you what the top, I'll just say 3, the top 3 chronic conditions are. In Anne Arundel County, heart disease, cancer, and stroke. So that means that it's definitely in your non-medical home care area. It could be someone with high blood pressure, someone that had a heart attack. Thank you so much. Someone that had a heart attack that, maybe they need, meal preparation. They need care after a triple bypass surgery, anything. Cancer, you guys know I have a 3-part series training on how to market to individuals with cancer. Cancer should be a whole program. They need help during cancer and post-surgery or post-treatment. And then stroke. One of my home care mentees in the state of Massachusetts, she's currently taking care of 2 private pay for about 40-hour-a-week clients who suffered a stroke. Guess how much money they're paying her an hour? $38 an hour. Private pay for 40 hours a week. Let's do the math before we go to another state. How you guys like that? $38 times 40 hours a week. That's $1,520 per week. That's $6,080 per month. Times 2 of those clients, she's already at $12,000. Let's just say $12,000 even per month with just 2 of those clients. My computer is spooling again. Times 12 months, she's already at 6 figures, 145 clients, 45,000, a little bit more. So, and that's just with 2 clients. Imagine if she gets 5 more, which she will. Okay, so now let me go down to 2 other counties. And if you have any other questions, please post them in the comments. And then we're going to end tonight. Sorry, I keep checking my water. As you guys may know, I had oral surgery, so I go for my follow-up tomorrow. Okay. So another county we were looking at was Prince George's County. Now, theirs was heart disease and diabetes. And actually, they have had some deaths from diabetes. It's not, yes, I do. It's not as easy to market to individuals with diabetes, but you can, because basically they feel like, the reason why I say it's not as easy to market with someone with diabetes, it's like it should definitely be more than one thing, because they're convinced that they can handle it. But a lot of individuals who are diabetic and have no control, who are not good with that, with managing that chronic condition, that can lead to dialysis. And that will be an area that, basically you can definitely help them out with. How often do I go live? I try to go live at least once a week, because I do more stuff on Zoom, because I used to go live a lot, maybe 3 times a week. But what happens is that I just get more engagement. I like talking to you guys. I like getting your feedback. And then I can really share my screen and go a little bit more in depth in training. So that's a good question. And then I always, if you're following me, I always give tips in my stories. So that's definitely Monday through Friday. And I'm just going to give you one more county that we were covering. I think this one was Montgomery County. And that was arthritis, cancer, mental health problems, and coming up again. So that would be in a marketing campaign I would do with someone in this area, is that definitely kind of develop a good stroke program for them, stroke care program, and then partner with those facilities that, that could be like a rehab center or something like that. Partner with those referral sources for my home care agency. So yeah. So that is how to start a home care agency in the state of Maryland. I do have a home care licensing program where I work one-on-one with individuals to help them complete their license. And we do your policies and procedures, your forms for you, your business plan, all of that. And we do it with you so that you understand. I used to do it for people and me and my team, but the reason why I stopped doing that, unless someone absolutely insists, Sean, I don't have time, or maybe that's I would get contacted by a doctor or something like that once I start a home care business, is because of how I was taught by my home care mentor to start and grow my business. I want to share that same kind of experience with you, or whoever the person that's my client. I don't even call them my client. I call them my mentees. So I can mentor you into not only starting, but operating a very successful home care business. So we cover getting completing your application, but we also go into operational systems, what kind of systems you need to have in place, how you should be billing, your pricing strategies, how to do your recruitment, how to do your job post, where to post that, specific marketing strategies, like I said, for your area. So it depends on if you are in Maryland, then I would say, okay, let's do these 3 strategies. If you're in Pennsylvania, I might say, let's do these 4 strategies. If you're in Georgia, I might say, let's do these 6 strategies. So it definitely is by the demographics and the data that we collect, that we say this is where you would get the best results. And that's how you go to growing a very successful home care agency. Because when I said generated 3.3 million in 2 years, I had 13 clients. So just imagine 13 clients brought me in that much revenue. And you can see my testimony on YouTube where I say that it happened so fast because it took me 6 months back then to get licensed in the state of Maryland. And then it took me almost 9 months to get Medicaid certified. So in the meantime, I was just marketing to private pay clients. That's why I'm such a big advocate of private pay clients and letting you guys know that it is possible to get them. Don't let people tell you they're hard to get. My first 24-hour private pay client was a first 24-hour client was private pay. First client in general, and definitely have helped other people with getting private pay clients. So it's only difficult if you keep telling yourself in the mirror it's difficult, but they're out there and they're looking for good agencies. Even if they're with an existing agency, they may not necessarily be happy with that agency. Have you ever, ladies, have you ever gotten your hair done and you're like, if I can just find somebody else closer, I'm changing. She did this again. I told her I don't like the way she did this side of my hair. I've had some bad experience with braiders. I'm like, how far do I have to go to get my hair braided right? So you look at your competition with fear in your eyes when you shouldn't, because you don't know what your potential client may be thinking. You might be the answer to their prayers. But so I do it with you, and we have 2 one-on-one sessions in addition to our group training every month, and we work on your application, so you will even know by the time you have your renewal process, you'll know how to do it yourself. And all of our one-on-ones are recorded so that you can go back and listen to those for notes, and you just have all of that advantage. And people like it that I do it that way. And I always say, and I'll end with this, that I'm not a consultant. So if you go, I do consulting, but in this process for my home care licensing program, I'm your mentor. So this is a mentor guided program where I help you get licensed and help you understand your home care business so that you can be successful. And then after that, you can just, you can stay connected, which a lot of them do, and, join my marketing mentorship program and just continue to grow from there. So if you guys don't have any other questions, we're going to get ready to end the broadcast for tonight. I do appreciate you joining in. If you want to learn more about my home care licensing program for your state, just send me a DM. We can get on a free consultation call. The link is in my bio. I'll share with you guys my Google reviews of people that's worked with me. You can check me out on LinkedIn to see my educational and corporate background and all of the states that I've worked in. So I put everything out there. You guys can see it, so you know what to expect. And I don't work in states. If I've never worked in that state before, I will let you know. I don't be lying. I don't be like, oh yeah, we could do that, and then we tested it out. No, I'll let you guys know. No, we don't work in that state. We haven't touched that state. This is what you can expect. I just, like to be transparent like that. It's not, hey Tammy, how are you? It's not enough of that transparency out here in these home care streets, because most of you guys may know you've been looking for this information for a long time, and most people are like this. I ain't saying nothing. I ain't say nothing. I'm going to let her figure it out. I know so many people contact me to say, I have a friend that has a home care agency and I thought they were going to help me, but no, they're not helping. Hey, beautiful. Or maybe they didn't like the way that they run their home care business. So they said, I want to do things right. So I'd rather work with you. And then lastly, if you want to do it yourself, I do have a couple of DIY do-it-yourself programs for certain states. Certain states are a little bit easier than the other. What does that mean? That you would get the policies and the procedures, and you would just plug it into the checklist for that state. So you can just basically work on that by yourself and then submit it, and then hopefully you'll come back and join the home care licensing program. Your question is, do you assist with documentation such as proposals or training documents? Yeah. So that's included in my policies and procedures, and I have policies and procedure templates as well as it's in my home care licensing program. Like say, for example, for Pennsylvania, Pennsylvania has a DIY, do-it-yourself licensing kit, and it includes like caregiver tests, like it has the test, and then you have the answers, how to do their assessment, tips for their training. So yes, we can help with that. We could definitely help with that, breakdown of that training. What state are you in? Asking that question. Are you in the state of Maryland? Maryland wants to know for that part of the license. They more so want to know how that you're going to do it. What are the subjects? They don't necessarily want to know they don't necessarily want to see the curriculum sometimes. Yes, I help. Yes. Currently, I am doing waivers doing Medicaid waivers for Maryland. For PA, there's more so like not a waiver, the MCO, and Georgia. And I have to go, guys, but I'll let you guys know all of the states that I've worked in. Like I show people, I have a certificate from the state of California where I went through there. You guys probably can't see it as well. Went through their licensing program, which is really, really hard. So, like I said, you can always, all my links are available in my link in my bio. You can always check me out and verify me. But thank you so much for your time, and bye for now. See you on the next live.